Hemoperitoneum, the accumulation of blood in the peritoneal cavity, is a common diagnosis in dogs. A major cause of hemoperitoneum is the rupture of tumors in internal organs, particularly in the spleen. To predict the course of hemoperitoneum, clinicians usually focus on investigating the pathology of the tumors. Data suggest that in up to 96% of canine hemoperitoneum cases, the tumors are malignant, most commonly due to a type of cancer called hemangiosarcoma, or HSA. These findings, however, were based on retrospective studies, where there is a high probability of biases that could lead to the overestimation of the actual prevalence. The current long-term prognosis for canine HSA is poor, and diagnosis is often not confirmed until after surgical treatment. Poor prognosis, combined with the perceived high probability of HSA as the cause of hemoperitoneum, can cause some owners to opt for euthanasia at diagnosis, rather than pursuing surgical treatment. To bridge this gap, researchers prospectively studied a cohort of 40 dogs diagnosed with hemoperitoneum secondary to splenic tumor rupture. The ruptured masses were removed via splenectomy, and patients underwent standard post-operative care including blood transfusions, cardiac telemetry, and close monitoring. The findings were promising, as the incidence of HSA was 62%, much lower than the commonly accepted rate, suggesting a higher probability of benign splenic tumor as the cause of hemoperitoneum. 95% of the patients survived and were discharged after a median hospitalization of 39.5 hours. Although this was a small study, the researchers believe that it generates hope for better prognosis of canine hemoperitoneum, with a significant proportion of these dogs having benign lesions and being cured with surgery alone. They encourage pet owners to take part in larger prospective trials aiming to improve the long-term outcomes of dogs with HSA. The researchers soon plan to launch a 400-dog prospective trial called the Ethos Precision Medicine Umbrella Study for Hemangiosarcoma, through which they hope to bring a curative outcome for dogs with HSA.